Good morning, everyone. Today is Thursday, March 30th, and I thank you for joining into our ACA webinars. If you were on last week, you were amongst the folks that heard that I would be changing the name of my webinars. It started out the Patient Protection and Affordable Care Act, PAHU webinar. We changed it just actually recently to the ACA. I had hoped that we could change it to the HCA this week, but we cannot, which brings us up to our first bullet point with our new topic, the new administration and what the heck's going on. Before I jump into it, I just want, again, to thank you for joining in. But if you do have questions that you need to ask, you can do it one of two ways, by just clicking on your hand icon on the control panel to the right of your screen, or you can type it into the question box and I'll answer them at the end of the webinar. So first bullet point, the American Health Care Act. Many of you were watching, I'm sure, last Friday to see what the vote would bring. Of course, the GOP, the House members of the GOP, were trying to vote on the American Health Care Act with a manager's amendment. They met feverishly with the Freedom Caucus and hoped to add more amendments that could bring them closer together and get this bill through, but unfortunately that did not happen. So you'll see the poof, up in smoke. That's what happened to the American Health Care Act. What will happen next? When I saw the press conference from Speaker Ryan on Friday and the fact that it was being pulled, it almost sounded that this was a done deal, moving on to tax reform, no further consideration of repealing or replacing the Affordable Care Act. And I purposely did not watch the news over the weekend because, quite frankly, I was so angry and I thought I don't want to even hear any of these pundits saying anything. So I didn't watch all weekend, but I did watch on Monday morning. And from Friday until Monday, it does seem that they are going to not let this necessarily die, but try to get to some sort of agreement to move forward with repeal and replacement of the Affordable Care Act. What that timetable is, I have no clue. Certainly we'll keep watching. What's left, my second question, what relief, if any, will the previous executive order provide? I did, pardon me, I did include the Stabilization Executive Order. That's the Marketplace Stabilization Act. And there's a lot of things within that. This was released in February and the comment period ended early March. I do have some emails out and some calls out to see where this stands, what's next for this executive order. But there are a lot of provisions within the executive order that maybe will make things livable. I don't know. But I did include that in one of your handouts. Some of the provisions, guaranteed availability. There's going to be a 3-month grace period for payments for the folks that have the tax subsidies. The carriers are going to have to pay the claims for the first month. And then if the insured does not make their payments within 90 days, full payments within 90 days, then they will have to refund that advanced premium tax credit. But this way the carriers don't have to continue to pay those claims as they get through their grace periods. There was open enrollment for the individual market for 2018 was slated to mimic this year's, which was November 1st through January 31st. This executive order seems to indicate that may change to 11/1 to 12/15. So that's within the executive order. Special enrollment periods, they're going to redefine some of the minor qualifying events to really try to keep people having continuous coverage, not jumping in and out. They're proposing a pre-enrollment verification with an application. It's going to be, essentially they can enroll but will not be activated. They'd have 30 days to upload proof, and that's going to be on 100% of the people with qualifying events versus 50%. Anyone in the individual market, I think that's a good thing. And metal level coverage upgrades, they're going to, let me see here, instead of the metal level coverage upgrades, right now if somebody has a qualifying event such as they get married or have a baby, that entire family has the ability to move from you know, a bronze plan, if they're on a bronze plan, to a platinum plan if any are available. So they're going to try to deter that so that people don't jump up in metal levels just because they know they have claims. Eligibility limits, considering allowing insurers to reject qualifying events or SEP enrollments for those that lost coverage due to no premium payments. In other words, they lapsed their coverage due to non-payment. So they may have carriers may have the ability to say, I'm sorry, that's not a qualifying event. They're going to, there's exceptional circumstances, qualifying events, they're going to limit those. They talk about continuous coverage, possibly assessing a pre-existing clause if somebody does not have continuous coverage to prevent people from jumping back in and out of the system. Again, all of this is just, it's up for public comments, so it's not written in stone, obviously. They're going to make changes to the actuarial value, which may afford the carriers to offer more HSA plans. Right now, their actuarial values have to fit within those metal levels with a +2 or -2%. The proposed ruling is going to allow for a -4 and +2 percentage points, and then on the bronze, a -4 and +5. So there's going to be greater flexibility in getting plans to fit within the metal levels. They talk about network adequacy, that there's sufficient providers. This is going to, of course, maybe eliminate some of those really narrow networks that are coming out. They also, there's a provision that makes carriers have 30% of their providers being essential community providers, such as community health centers, family planning clinics, safety net hospitals, and they're proposing that instead of the 30% of their providers being these essential community providers, that they would allow for only 20%. So there's a lot of meat in that. Again, I have it attached for you if you choose to read it. But yeah, we'll see what happens. And of course, I believe it was yesterday, Bernie Sanders proposed Medicare for all. You know, I guess that's in with Bernie's free college for all. It's Medicare for all. Only a true socialist would talk about Medicare for all, since Medicare is not really financially stable in and of itself. So again, there's a lot of things happening, more than I thought we would have happening at this point, since the American Health Care Act is dead. So again, we'll keep watching. I have, you know, this partner sign down here, and we are your partners. We're going to keep watching this. We're going to make that lemonade out of lemons, you know, and try to find the silver lining, if you will. There's opportunity when there's chaos. So certainly there's no stabilization that's coming up in the near future. I do believe that 2018 individual health enrollment, because of where we're at with the American Health Care Act and with the carriers having to file their plans, even though they've been given extra time, I don't think that the individual market is going to be any different really than it has been this year. You know, the group market, again, I think is pretty stable. I had really hoped for the 50 plus to do away with the employer mandate. Maybe that will happen, maybe it won't. But again, we have the resources and we have technology platforms that can assist you in this chaos. So so you can be the voice of reason and that conquering hero for your group clients as well. On the individual side, our next bullet point, there is a lunch and learn on April 11th from 11 to 1. Chesapeake Life is coming in. They have various products. I did include their product availability chart because I do think that if you're playing in the individual market now or for 2018, these products may be something to to offer it as a replacement. They're not qualified, so your insured would still have to pay the individual tax penalty if it stands, if it's enforced. But otherwise, there are plans that could complement a bronze plan or any other health plan. So I think with this atmosphere and the uncertainty that we have, if you're available on the 11th, it probably would be, in fact, it will be worth your time and effort. So if you have an interest, the invitation is in my newsletter this week. So sign up and hopefully you'll be able to join us. Another webinar is on the 27th of April. That's the Starmark webinar that I've talked about the past couple of weeks. That's 2 to 3, and that's going to discuss Starmark's new product, which is not tied to any provider network. So they're calling it a game changer, and I believe that it is. Another game changer and exciting news is, as many of you know, we have a benefit admin system through Benefits Connect, and it's a very, very robust system. It's really built for larger groups, 50 plus or 100 plus. It has EDI feeds, it monitors the measurement periods, alerts folks that have come to the end of their measurement period as far as their eligibility. It kicks out their 1095s and 1094s. So we have that system, and we've had that for about a year. We've not advertised greatly for that because it really is for specific groups. Right now we're requiring a 25 plus group with 5 lines of coverage to utilize the Ben admin system. The exciting news is we did make a decision to purchase a system for the smaller groups that's a little bit more user-friendly for the end user, and also, it is more of a day-in, day-out sort of system. It does offer the online enrollment. It's offering the quoting portals that we're going to be using to supply your group quotes, but this will be used for groups 2 plus, and it's pretty exciting for us. And I would just ask you to keep watching for more information, because certainly the way the market is trending and a solution to some of the issues. For instance, this system does all the employee onboarding. So if you have a new hire, you give them a link, they complete their I-9s, their W-4s, they get their COBRA notices. So again, some of those compliance issues and onboarding issues will be streamlined. So we're really excited about it. Again, watch for more information because we'll be getting some details out to you shortly. This is another thing I thought about over the weekend, the PAHU Day on the Hill. After Friday, I was like, well, what do we even have to talk about at the Day on the Hill? But there are things that we can still talk about. And we'll be getting our talking points. I don't have the official invitation yet for the Day on the Hill, but just keep in mind that it is on the 25th. That's a full day in Harrisburg. There is a pre-meeting, a prep meeting on the 24th from 6 to 8, I believe, and there will be CE credits, and I'll get you the time for that. But there's going to be CE credits and a roundtable discussion with various folks to talk about their approach and their thoughts on the Affordable Care Act at this point. So keep watching for those details as well. Healthcare.gov is sending notices out to those that may be dually eligible if they are currently through the marketplace and receiving an advanced premium tax credit or cost share reduction, and they are eligible for Medicaid and or CHIP. They are going to be reaching out to these folks. please have your clients, if they do get these letters, respond to these letters ASAP, because if they are eligible for Medicaid and CHIP, they are not eligible for the advanced premium tax credit. So if they do nothing, they may have a bill that is doubled or tripled because those tax credits and cost share reductions will be removed. So please make sure your clients are mindful of the letters that they receive. NEPA is going to be adding, well, Highmark East, formerly NEPA, will be adding the Blue Edge Dental for individuals. That's coming soon. We just got the announcement. So again, we'll let you know when that's coming. And a lot of talk on short-term medical. We just received an announcement, and it's in my newsletter from Capital, that they will not honor short-term medical sales after March 31st. So if you have somebody on the ledge or interested, please write those short terms before 3/31, before tomorrow, because otherwise anything from 4/1 on is, and still available for sale, is only going to be sold for a 90-day duration or less. HCC, which is Amigo, National General, and IHC are all offering short-term medical products. And they are 90 days. Pennsylvania is allowing for rewrite, so they can write 90 days and then rewrite for another 90 days, etc. Capital is saying that they are going to reserve the right to bring back their short-term product. When that will happen, if it will happen, I don't know. And of course, Highmark pulled their short-term product earlier this month. On a sad note, just let me back up to the short-term coverage. Different states have different rules about rewriting. So if you are writing outside of Pennsylvania, give Judy Reed a call or myself a call, because different states have a different take on eligibility to rewrite within the same carrier. So just be mindful of that. And announcement from PAHU and Vince Phillips. I don't know if any of you have seen it, but Vince Phillips has announced that he is resigning as the PAHU lobbyist as of June 30th. So many of you in this industry have known Vince for years. He's been with PAHU for almost 20, being the lobbyist for PAHU, and you know, certainly a wealth of knowledge. Certainly a man that deserves some time off as well. So we certainly wish him well. He's certainly going to be available to, you know, for insight, and I'm going to tap into that. And you know, until his official resignation, we are still having Vince's Corner, and we may continue Vince's Corner after his resignation. But this week there is a multiple choice question about the American Health Care Act, and I think you'll at least have a lot of fun answering it. So when my newsletter comes out, take some time, if you will, and answer Vince's question. And before we get into the open forum, I just want to once again remind you about what I have attached. I have the stabilization, marketplace stabilization executive order attached. I have the SureBridge Chesapeake Life product availability by state. And I also included our 17 tools flyer. For those of you that are Gemini partners, the bonus pool just bumped up to $35,000, started at $25,000. But I also wanted to remind you that a lot of these tools that we're offering, such as complimentary summary of plan document creation, complimentary POP document, complimentary COBRA for groups of 20 plus, the benefit notice generator, or the benefit notices, those are things that we offer not only if you're a Gemini partner, but if you're doing your group business through us. So there's a lot of value that we're offering, and I hope that if you are doing your group health business elsewhere, that you give me an opportunity to have a discussion with you and let you know the new and exciting things that we're offering. So with that, I will open it up for questions, and let's see what we have. Oh, I have no questions. Wow. Okay. Well, that either means I did a really great job or a really bad job. So hopefully it was the really great job. So that really brings us up to the end of the webinar. We'll meet again next Thursday, the 13th. And as always, I truly appreciate your business. I appreciate you joining in. And I wish you all a great balance of the week and a wonderful weekend. Bye-bye.